Well, after an emergency committee meeting which lasted for several hours on a Friday, the WHO has decided against declaring the current Ebola outbreak an international emergency. This is the third time it has done so.
It was the view of the committee that the outbreak is a health emergency in the Democratic Republic of Congo and the region, but it does not meet all the three criteria for a public health emergency of international concern.
Well, the organization said it's against unjust reactions and unnecessary restrictions. So it said if it did declare it an international emergency, then there would have been a risk of restrictions on trade and travel to the DRC. And they said that airlines could restrict flights to the country and impose various border restrictions that would hurt the economy of the DRC. So the organization said it had nothing to gain from declaring it an international emergency. However, it had potentially a lot to lose. And while saying that the risk of it spreading internationally is quite low, there is still a higher risk of it spreading to neighboring countries, like what we saw earlier in Uganda, where a young boy and his grandmother died of Ebola after traveling from the DRC to Uganda. So border controls is a big issue there, and the Red Cross even says that one of the biggest challenges is the porous nature of the border between the DRC and Uganda. And so the WHO recommends for risk countries to improve detection and cross-border screening. Also, the WHO says it needs the international community to step up its funding. It needs $27 million as soon as possible to help with the Ebola response, and it is urging member states to step in. Lyubova, CGTN, Geneva.